Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Today's show is about a disease that can make your eyes turn yellow, shut down your liver, cause cancer, and affects up to 300 million people worldwide. May is Hepatitis Awareness Month, specifically viral hepatitis. I'll discuss the different types later in the show. Organizations throughout the United States work together to raise awareness about the importance of screening and prevention of a disease that kills over 1.5 million people globally each year. Let's get started. So what exactly is hepatitis? It means inflammation of the liver. Hepatitis can be caused by toxins, heavy alcohol use, certain medications, and medical illnesses. For example, autoimmune hepatitis, as well as bacteria and viruses. Today, I will focus on the three most common types of viral hepatitis: Hepatitis A, B, and C. Are all three viruses transmitted the same way? No. Hepatitis A is a highly infectious liver infection spread by fecal-oral routes. In other words, when a person ingests fecal matter, even microscopic amounts, from food, water, or other objects contaminated by feces or stool from a Hep A infected person. In contrast, Hepatitis B and C are transmitted through bodily fluids such as blood and semen. Hepatitis B can be spread by sex with an infected person, birth to an infected mother, sharing objects or equipment contaminated with an infected person's blood, such as razors, syringes, medical equipment, and poor infection control in healthcare facilities. Hepatitis C is primarily spread through blood from an infected person, similar to hepatitis B examples, as well as blood transfusion or organ transplant before 1992, when widespread screening began. Symptoms of hepatitis include nausea and vomiting, abdominal pain, discomfort, fatigue, loss of appetite, dark urine, jaundice, which is yellowing of the skin and whites of your eyes, and clay-colored stools. Acute Hep B and C can resemble Hep A, but chronic Hep B and C can be asymptomatic for years, if not decades. This is why testing and screening is critical, and I'll discuss this soon. So what about complications? Both chronic hepatitis B and C can lead to serious health problems, including liver damage, liver failure, liver cancer, i.e. hepatocellular carcinoma, and death. Screening or testing is the only way to know if you have hepatitis A, B, or C. Did you know that 66% and 40% of people with Hep B and C respectively don't know that they're infected? As a result, they could be inadvertently spreading the virus to others. Early diagnosis is key in preventing advanced disease, complications, and death. Screening involves a simple blood test. So, how is viral hepatitis treated? Hep A has no specific treatment other than supportive care, for example, IV fluids, meds for nausea, rest, and avoiding hepatotoxic medications like acetaminophen or Tylenol. Chronic Hep B can be treated through immunotherapy, that is interferon therapy, or antiviral drugs, such as Lamivudine Tenofovir or Entecavir. Chronic hepatitis C, however, is connected to good news. 90% of cases can be cured with 8 to 12 weeks of oral therapy. Prevention, more good news, is that both Hep A and B can be prevented through vaccines, through a 2 or 3 dose series. A vaccine, unfortunately, does not exist for hepatitis C. So how can you make a difference? You can donate to, volunteer with, and learn more from the American Liver Foundation, the Chronic Liver Disease Foundation, the Hepatitis B Foundation, the Hepatitis C Association, the National Hepatitis Corrections Network, and immunize.org. Well, that's all for today, and here's your joke of the day, liver theme. What did the doctor say to the patient who needed a liver transplant? It's live or die. I'll see you on Wednesday, 3 p.m. Eastern, when I'll discuss preeclampsia and teen pregnancy. Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.